But before we get started, let's just do some introductions. I am Timmy, and I am the marketing director for Eden AI. Eden AI is a startup that we have created that is designed to help to solve problems that we see, with businesses that we see in specifically here in the healthcare industry, that we want to solve the problems and help make not just not just make a profit, but also solve problems that make the community that we're in better and to make it a better place. And our hope is to make AI front and center in those decisions, those questions, and to solve problems that are cropping up here. And this is one of the platforms we're using, where we just want to let people know what can be, what will be, and what exactly is happening, and how to help people to understand how to position themselves, to direct themselves, and how to get the most amount of impact for what's happening. Yeah, I'll now pass the center to our CEO, Bami Oni, the visionary behind all of this. The man that if it wasn't for his mind, if it wasn't for his brain, none of this would be happening. So let's just, give a round of applause as we just welcome our CEO, Bami Oni, to just come to the center stage.
Thank you so much. Yeah, I was like the man, the myth, right? Thank you so much, Timmy, for bringing us here and for starting off for us. I think we're gonna have a really good time here. I just wanna also get a good idea of who's in the room. Just by raising your hand, if you're someone from the technology space, so like IT, AI, can you just raise your hand? If you're from an IT space, just raise your hand. Signify if you're from an IT background, IT space. Okay, we have 1, 2. Can we have, is it only 2 people on the call from an IT background? Okay, 3, 4. Okay. Okay. We're having more people join. All right. We're having more people join. If you're from an IT background, can you just put up your hand? Cool. All right. So, and then if you're from a health background, healthcare background, so let's say you're a doctor, or like you work in the hospital or something like that, can you just put up your hand so we see healthcare background, just to get a good idea of who's in the room, where they're from, what they're doing. If you're from a healthcare background, let's see your hand up. Okay, so we have quite a number of healthcare people in the room as well. So great. And if you're like a student, let's say you've not gotten exposure to like industry level yet type of work, or if you're just a student could even be a student in the healthcare space, even IT, but just even in chemical engineering or something like that, that's just different. Can you also put your hand, and you like have this interest you're aspiring as well? Can you just put up your hand? Can we see in the room? If you're a student, just put up your hand. Anybody who's a student who's not gotten industry experience at all? Okay, so there's no one of that nature. So it's mostly industry professionals. Okay, great. So yeah, guys, welcome so much, and thank you so much for coming to this talk. Today we'll be speaking about something that Eden AI is really pioneering. We started 5 years ago in the thick of COVID, trying to understand how to better meet the needs in the market for artificial intelligence. And we, in that journey, became a lot more exposed to what was happening both in healthcare, finance, especially, and then other aspects of business in general. And in doing this, we came across some projects that were AI focused, but back then in 2021, I don't know how many of you can remember, but ChatGPT, I believe, was released late in 2022. So in 2021, there wasn't as much generative AI focus from the market. Not many people knew about Gen AI. Most people thought, Gen AI is quite upcoming, but not never really saw it as something that could be used in any sort of real world setting, apart from like even not even a clinical setting. So we're not even speaking about clinical settings, but now we can see there's a rapid adoption of Gen AI solutions in even the clinical setting and also healthcare general setting and in every other aspect. And so this spike of need that we're facing currently is one that needs some help. You would need some help to navigate, right? If you were interested in this space, because there's just so much happening. I know like this past week, for example, Bill Melinda Gates Foundation, um, with the Novo Nordics and Wellcome Trust Foundation came together and put out a call that closed this week on um, evidence-based AI solutions and seeing how they could apply that kind of solution in our context, right? And even I think earlier as well, last year, sometime, OpenAI got into an agreement with the Rwandan government around healthcare solutions in this space. So trying to have these clinical implementations with AI healthcare solutions. That was something that they clearly looking at, and more and more I think in the healthcare space you'd see more of this type of innovations and types of innovations. And healthcare is quite different because it's quite live, if I can call it that. It's if when you hear healthcare, generally it has to do with improving health of people. So it means that somebody's health is being impacted by this. And when you think about other industries like agriculture, finance, it's speaking about maybe a finance will be speaking about wealth, agriculture would be speaking about food and so on. So all these different elements um, are areas where AI can of course have an impact, but specifically in healthcare, when it needs to have an impact, it of course has a magnifying glass on because of the importance of healthcare. And so today we'll be discussing essentially how we want to navigate this space from an Eden AI perspective, also some of the things we've seen because we've been like explorers in this space and we continue exploring. And some of you as well on this call will also be explorers in the space. So the first thing I'd like you to do is just name one thing um, to learn before doing AI in healthcare that you believe that you should be learning before doing AI in healthcare. So, okay, it's coming up. Okay, view results. Let's see the results. Okay, so there we can see tech, we can see regulation, we
Sorry,
can
I'm just
see
gonna
data
go back.
analysis concepts. Thanks to me, yeah, we can see it on this side. So we can see data analysis concepts, we can see ethical considerations, ethics policy. So you can see there's quite a number of ethics actually. So we see some ethics like four related ethics related, policy related, regulation related things. Two things about tech, and then one basic competence. Okay, great. So we can get an idea that many people feel like ethics is a really important topic when you're thinking about AI in healthcare, and rightly so. So let's go to the second question. The next question, see me, I think it's fine. You can just still stay on the screen. I don't need to share. The next question is name one thing you think you need to unlearn when trying to use AI in healthcare. Next question, this is the next thing. One thing to unlearn. What is one thing you think you need to unlearn? This probably needs you to think a little bit harder. Okay. Name one thing you think you need to unlearn. Okay. Are we writing our answers there in the chat? Okay. I've submitted my answer as well. Why do we feel like we need to unlearn ethics? Okay. I don't know who said that. You should be fined for saying that. Maybe it depends on where you're coming from, right? If you feel like maybe certain types of ethics, right? Maybe a certain view of ethics because they're different view of ethics, fair enough. Nothing to unlearn, okay? Okay, dependency. I wonder who's said dependency and what they mean by dependency. I think that's ex interesting. If I'm sure you can still write an answer. If you wrote dependency there, just maybe expand in a way. Okay. What is one thing you feel you need to unlearn before doing AI in healthcare? Okay, data analysis. Okay. Okay, traditional analysis. Okay, okay. One thing to unlearn. Okay, cool. So with healthcare, the one thing that I specifically started to unlearn was the idea that healthcare was just clinical health care. From a person who just went to the hospital, maybe went to the doctor or went to the pharmacy, my healthcare is my healthcare. That's the version of healthcare that I see or that I saw, right? But in getting into the space a lot more, what I started to realize was that healthcare was very, very different. It was multi-layered in many ways. Like you would have healthcare on a personal level, you have healthcare on a public health level. I remember even the first time I spoke about public health, and someone mentioned to me that, public health includes public and private, includes the public health sector and the private health sector. And then public health sectors, when you're speaking about, for example, public health, that's like going to a public hospital, sorry, like public health sector. That's when you're speaking about public health sector. But when you say public health, you mean both public and private health. But I didn't realize that before. So what I started to realize was that healthcare is, in a way, the word that's coming to my mind is multifactorial, but it's just multi-layered. There's so many layers to it. And sometimes when you think about AI in healthcare, you can be so tempted to think about one thing, with relating to AI in healthcare, or one place, maybe clinical health. But instead, there are so many ways AI can benefit healthcare patients. So, or healthcare in general. So, from a patient perspective to a planning perspective, for example, one of some of the work we did was with the government of Ethiopia and essentially helping plan across various comorbidities and giving them insightful data and graphs on their their own data and helping them to plan for like specific PEPFAR um related measures, the things, metrics that they were interested in, valuations. And that is also an aspect that can be done with AI. And so I believe that healthcare in unlearning, one of the things we need to think about is that healthcare is not just my healthcare, it's our healthcare. It's very, very vast in that way. Cool. So thank you, Timmy, for that. So the next question, um, yeah, can we go to the next question, Timmy? I actually would have loved to show a graph there, but it's okay. I can always show you that graph later. So then the next thing, we were finding as we were going through things was that we were realizing that, in trying to find these different layers and understand the different layers of healthcare, there were certain problems that were existing in those spaces, right? So you'd find that maybe for a government, they want to understand what's happening within the population. They want to see how many health posts have been, brought out, how many people are taking, let's say, their ARVs, how many people are getting tested, where are the health posts being distributed. For them, decision making and making program planning for healthcare was so important, right? And then it's a problem because they needed insight into what was happening so that they could make the best decision for their people, right? But then there's also another space that we got into when we realized that there's healthcare on a clinical, on a doctor-patient side, when we speak about the clinical setting and we speak about consultation, and we realize that, in the public health sector, there's long clinic queues delaying people from getting help to access to the help that they need on time. right? That is also another problem space that you can identify and you can also look to resolve, right? Another aspect could be, for example, there's a company called Jacaranda Health, which will look into some of the examples, case studies. And Jacaranda Health specifically um, would be they use SMSs to help women in with maternal, neonatal, and child health care scenarios. So people can like SOS, and it's an LLM in the background that sees these queries and I believe triage the queries in order to get the women access to the healthcare that they need. Another company that does something very similar is a company called MDoc as well, with their chatbot called Chem. They're doing the exact kinds or similar things in line with their complete health platform where they are trying to help women and people in general get access to care information very quickly by having an AI that goes into a knowledge base, gives you information in regards to your health and just in general healthcare information. And some of these companies that we're speaking about have been funded by global funders like Bill and Melinda Gates Foundations, and so on. But the question is always what is the problem space and like how do you see the tech that you're working on, and whether or not it's relevant to solving the problem. And usually people miss the mark because there's the problem space and there's the tech, and sometimes from an implementation perspective, the tech does not enter or does not fit into the problem space, and that's where they call it implementation sciences in healthcare, right? Because you have this theory of how this tech can help, but when it comes to reality and the issues facing people on ground with different languages, technology limitations, for example, with Wi-Fi and so on, you start to find that the tech actually, though relevant, may not be relevant to the problem space. And that's also an area that people need to be aware of, and we need to be aware of as we tackle healthcare in general. So that's the next thing. So in trying to like discover what it is that you want to solve, um, you need to know that, okay, this tech that I want to use to solve this problem, does it actually work for my problem? Okay. Then, of course, the next question is what are healthcare professionals looking for? I wish I could show my slides. They're really nice, but I think it's better if we look at Menti and we see, how people are responding. So when we look here and we say, what are healthcare professionals really looking for? We're speaking about what they really need, right? So from all aspects, if you know any healthcare professionals, please just put it in the chat. We have quite a number of you on the call, so just type in there, this is what we're looking for. This is how we feel like we could be helped. Even if you're not from a healthcare, you're not a doctor, you can still be a healthcare professional, right? So maybe from another aspect. Oh, there we go. Somebody said simplicity. Someone said efficiency. In fact, if you're in tech and you feel like, healthcare professionals require something, you can also put it in there, even if you're not a doctor. If you're not a doctor and you're not in healthcare, and what do you think they need? You can also add it as well in there. What do you think healthcare professionals need? So we can see efficiency. Two people said efficiency because it's a lot bigger than simplicity. But actually, everything is actually speaking around the same topic, around this sense of efficiency, seamless integration, more organized systems, simplicity. Okay. What about others, people in tech? What do you think healthcare professionals need? Quality. Okay. Okay. Great stuff. So essentially, this is one of the problem spaces that need addressing, right? And I think the more we can address these kind of issues with whether with technology or not with technology, the better it is. Essentially simple solutions to complex problems, make things generally better. So let's move on to the next one. The next one, we will say, what are funders looking for? So who are the funders? So one of the things I realized when I came into this space is like, unlike the private, sorry, let's say, finance sector in South Africa, where you have a big bank and you're working in this large corporate, because I worked at RMB for a few years as well, and I saw a different part of the world compared to this. But the funders generally in healthcare are so important for healthcare scenarios because the funders actually fund health programs across countries. So when you're somebody who's like building a healthcare system or a system, usually in order to get this system out there, you need to have someone who's going to back it with money, right? And that's if you're not like, if the system is more, let's say, research and development, or if, for example, you're even a government who wants to do something, who's not, earning money, who people are not paying for certain things, you would need funds. And the funders are like people like Bill and Melinda Gates Foundation. I mentioned Wellcome Trust earlier, Grand Challenges. Actually, I have quite a few of them here. In my slide, UNICEF, CDC, each one of them has a different thing that they are trying to maximize, right? And so here we can see that um, funders will need certain types of things. So say resource efficiency, risk mitigation, faster turnover time. One of the key things that also founders want to see is things that can solve problems at scale. So let me actually share my screen, Timmy. I'll just quickly steal it from you, and then you can steal it back from me. Um, I don't know why I'm using the word steal, but you can take it back from me. Um, so here is the some of the funder landscape. This is specifically for Africa, but here is like just a snippet of what the Gates Foundation and the Novo Nordics Foundation had for this evidence in AI in health initiative. So it says AI has the potential to strengthen health systems from diagnostics to optimizing clinical workflows. AI tools could offer affordable solutions to address healthcare inequities, particularly in low and middle income countries. But there is limited evidence about how well AI tools work in practice, right? So making it difficult to know which innovations are ready to adopt and scale up, right? So you can see this gives you insight into some of the things that they want to see. They want to address inequalities. They want to solve things at scale, not just for one person. They don't want you to build something that's going to solve things for one person, but they want to solve it for like 1 million people. And they want it to be working in practice. And so here, for example, they're giving 300, or they've invested $300 million in partnership with the Gates Foundation and the Novo Nordisk Foundation to support clinical global health research and development. So as somebody now who's like thinking about all these different problems, the questions I have to ask myself is, does the solution that I'm bringing meet the funder's demands or the funder's requirements, right? Does the solution that I'm bringing meet the funder's requirement? If the answer is no, then I have to go back to the drawing board. But if the answer is yes, then there will be other things that follow. Some of the things that could follow could be, do I have the credentials to be able to meet the funder's demands? For example, when I say credentials, I mean experience. Have I done enough work, to be able to meet the funder's demands? And maybe if I haven't done enough work, is there somebody I can partner with that can help and we can work together in order to meet the funder's demand? So this is really, really important. So we'll just go into some examples right now. Very quickly, because we already short on time. So we'll go into some examples right now. So the first example we want to look at is us, like Eden AI, right? Eden AI is a very good example. One of the solutions we've built is called Lulama. So Lulama from Eden AI is an AI-powered clinical assistant that's backed by the Meta Impact Accelerator, and it's a solution that reduces administrative burden, streamlining documentation and information during patient consultations. Lulama, for example, we currently, building it out, working on it, and we're looking to improve it. We're also looking for different opportunities that can help us better deploy Lulama, right? So this is I'm sure if you follow us on social media, if you don't, please follow us on social media. Please, Timmy, just drop our LinkedIn, link in the chat or Twitter or Instagram. Just make sure that you follow us, right? And then as you follow us, you'd be able to get updates from us around many topics. But one of the things we speak about is Lulama. So another company that's doing this kind of work, I mentioned Jacaranda Health before. It's a non-profit organization that uses technology to improve maternal newborn healthcare, neonatal child healthcare in Kenya through an AI-enabled SMS-based platform. This is built through prompts, but it's using LLMs, right? Another company that I don't know if you've heard about, InstaDeep, they were actually acquired in 2023 by a company called BioNTech for about 500 million euros. And they were building AI-driven health research, particularly in drug discovery, genomics, and pandemic surveillance. So, for example, they built this system called DeepChain um, a protein that essentially it's a protein design platform that analyzes protein sequences and delivers that in minutes. So you can see this protein sequencing is now in the labs. It's very different from the standard My Healthcare scenario that I spoke about before. And yeah, the reason also why this company is quite well known in our case is because they are from Africa. They're the largest exit on the African. When I say exit, I mean, they sold their company for millions. They're the largest, tech company exit in the in the Africa ecosystem, and they were bought by BioNTech, which is, I believe, one of the companies that worked on Moderna, actually, which is the vaccine, Moderna vaccine. And I also have a few friends working at um, InstaDeep, but yeah, they're one of our success story from the continent. So other case studies is Mino Health Labs, Health AI Labs. This is in Ghana. This is actually FDA approved solution. It's an Accra-based medical technology startup that uses AI to automate medical diagnostics, prognosis, and healthcare forecast, right? They have this AI called Moremi AI, a generative AI platform for healthcare and biology. Essentially, you can go onto the platform, ask questions. I remember meeting with the founder um, in Rwanda. Was it last year? Last year, I met with the founder in Rwanda, and we are just having a conversation around the solution and how they've managed to, get so much traction and how they're having it run, in a clinical setting. And now I see that they've also gotten the FDA approval. He was mentioning how they take care of PII and all of that as they try to analyze data. So you can check them out. Mino Health AI Labs is quite interesting as well. Another very kind of feel good type of solution is twins is 4 Minute Medicine, which is from South Africa. It's two sisters. They were also part of us on the Llama Impact Accelerator, and still in contact with them. But they've been building this medical education edtech platform designed to help health students and junior doctors learn efficiently. So, for example, even like simulating certain scenarios you'd see in the hospitals and giving information to replaying scenarios for health in health institutions in medical health institutions for doctors so that they can learn on the go and giving them access to materials that's required and so on. So 4 Minute Medicine, I believe the sisters studied in UCT, and yeah, that's also another key example. So the final thing I would just like to speak about is how to plug in, right? So essentially in plugging in, what we mean is how do you get all this information? Because this is not even touching the World Health Organization and so many other aspects that we could speak about. But in terms of plugging in, what you need to do if you're interested in this space is you need to really follow people. You need to follow in like podcasts or videos on YouTube, follow channels that are speaking about like AI in healthcare or just healthcare in general, like people like the deep learning in Dava. Anytime I go to deep learning in Dava, which will be coming up later on this year, I make sure that when I'm at that conference, I attend all the AI in healthcare workshop. Why? Because it gives me new ideas, right? It also, lets me network with people, and so in plugging in like that, you're more like towards the scenarios that or the type of circles, yeah, type of circles that allow you to benefit or to like even add value to those spaces, right? And that's what I'd really recommend. I'd recommend, for example, following us in AI. We post a lot of healthcare related content. You can also like reach out to us. Like we have our email here on the chat, sorry, here on the slide, but also in general, reach out to me. Most of you would know me or would have contact with me or like follow or connect on LinkedIn, and then, plug into these things at different conferences. And the more you do that, the more you get an idea of what's happening in the African space, which is quite niche as well, because, Africa is still a developing or a third world, if I can call it that, third world continent, with most of the countries, if not all the countries actually there. So that's how you plug in. And yeah, finally, please connect with us. Like I said, this is some of the work we've done and our team. So please, connect with us, reach out to us, some of our partners that we've worked with, and some of the solutions we've done. So yeah, Timmy, I think that's it on my side. I just want to hand over. I know we short on time, really short on time. I took all the time to myself. I just don't know if there are any questions. Maybe over to you, Timmy.
Thank you, Bami. And yeah, like he asked earlier, if anyone has any questions, if we are comfortable with unmuting our mics, let's unmute our mics and say it. And if we want to, let's just type it out in the chat if we are not that comfortable with it. And yeah, let's just do that. And as we wait on that, there are some questions that we do have that has been, regular questions from the guys that we have. And that's like, from your experience, what is the biggest mistake that organizations make when they are trying to introduce AI into healthcare, like into their hospitals? And how should
Okay.
leaders think differently when about the adoption?
Okay. What is the biggest experience? I mean, biggest issue, right? I think the biggest issue is twofold. The first one is data. The fact that data is usually not cleanly kept or not available, and that is always a problem, you know. And the second one is just buying, trying to get everyone bought into this idea, into this new like this change. Because for example, in Africa, as you know, many things are manual. So changing the mindset from being manual to being a lot more automated is something that would be required. I think, generally as well, in terms of looking at AI, you want it to be something that enables rather than, disables doctors or people, healthcare professionals in general. You want it to improve these skills. And those are like arguments, right? So those are the kind of scenarios that I think people should be looking at. But yeah, those are the two
Okay.
pieces, yeah.
And how can people who are trying to implement these tools balance, with the POPI Act that's currently out? How can you balance, protection of private information as well as needing the data that you need to actually make the tool work as it's supposed to work? How can you, go through that balancing act to have both of those things work together?
Yeah, I think it's very important that, people are aware of the regulations and, they have people who are experienced in the industry to hold their hand through implementations, right? That's so important. And on our side, that's something we've learned and we've been doing more and more of over the past year or so. Especially since Lulama, we've been working on Lulama. Previously, we were just working on, because we're a consulting company as well, AI. And so we're just working initially on just AI solutions and data related solutions that our clients brought to us. So we build these custom AI solutions, but in terms of the implementation parts of it, they will handle it. In our case now, it's changed. The story's changed. Now we also implementing in the space. We identified a problem space. We've identified a solution. So now we're like building. We're now building this thing, networking with people, and also more and more trying to bring things to market there. So yeah, that's how we're working on that.
Yeah. So like we said, thank you all for being here with us. We appreciate it. Like we said, please just give us your feedback. And once again, thank you all for coming. Yes, round of applause for Bami for this presentation.